We all have dealt with a stuffy and runny nose, and it's really caused by many different factors, but how do you know if it has to do something with allergies? And I have the best people to answer that question, Dr. Friedman and Dr. Tobin. So happy to have you to help me answer this. I'm sure a lot of people wonder about that very question. Tell me first, what is a stuffy and runny nose?
Well, as we said, a stuffy and runny nose is a stuffy and runny nose. It means your nose, for the patient, feels more stuffy, more runny, more congested, more irritated. And when that happens, we're lucky here at Ohio ENT and Allergy Physicians that we have the opportunity to both look at it from an allergy standpoint and from an ENT standpoint. And that way we can really be a total one-stop shop.
So how will they know if they need to see you as the allergist or you as the ENT?
It's a great question. Patients call, they describe their symptoms, and our schedulers try to get them paired with the right specialty, but a lot of times they're going to see both specialties. So if they see the ENT first, we're going to concentrate on anatomy. We may get a CAT scan to look at the sinuses. We may use an endoscope to look in the nose. And then we try to determine, is there something that we can do to make the anatomy work better to help the patient's symptoms, and then to also help these medications to work better. Used to be, if you needed surgery, you had to go to the operating room, and nasal and sinus surgery sounds scary to people.
Thank God things have changed, right?
It's gotten a lot less invasive, and now we even have office procedures that we can topically anesthetize the inside of a nose, use these minimally invasive procedures to try to reduce bulk and size of swollen tissues and make overactive nerves less active, so there's less drainage and congestion. So a lot of great options out there.
About 30% of the population has allergies. So it's very, very common. And oftentimes when someone has a runny, stuffy, drippy, especially itchy nose, most likely they're going to have allergies. We can be definitive about that. We do allergy testing. We do what we call allergy scratch testing, and then sometimes we do what we call intradermal testing, and we'll define, do they have allergies? And if they do, we know how to treat them.
So, Dr. Friedman, do allergies go away? Is that a question that you really get all the time?
It's a great question. We do get that. And allergies can go away. There's a certain percentage of patients who, over time, who may have had allergies early in life, and they may improve. And that's, again, true of food allergies especially, but also some environmental allergens. But on the other hand, allergies can appear at any time also. The immune system is unique and very dynamic.
So what are some of the medications, some of the treatment options that we have?
Well, the first and most beloved allergists and ENTs is a nasal saline rinse, and this does so many good things. Saline cleans the nose, gets allergens out of the nose, gets mucus out of the nose, and helps the nose just to work better all by itself. And we can even add medications to these rinses to deliver the medicines better than some of the sprays can do. But I'll let Dr. Friedman talk about some of these that they use frequently.
This is an example of a nasal spray. This is kind of, I'm gonna use the term Cadillac spray. And one thing that's important, and they spend a lot of time, ENT, and we do too, in telling people how to use the nose spray, because they don't use it right. And one of the things, we'll shake it up, we'll put it in the nose, and we'll always aim it to the ear on that side. And that way it stays off the septum, you get less nosebleeds, and it gets in the nose that way. And this is kind of our second or third line drug. Over-the-counter medicines like Flonase and Nasacort are very good and effective. So we've got a nasal steroid, nasal antihistamine, or combination.
If you find you're using decongestant nose sprays, you're failing, and that's when you need to come and see us, because these are not designed to be used regularly and for long periods of time.
Okay, so if anyone has any questions, they can just come to Ohio ENT and Allergy Physicians, right?
Yes.
That's right. We're here for you.
Okay, thank you so much for helping us with that.
Thank you.
Well, there are multiple locations in the Columbus area that are ready to serve you. Book an appointment today and find a location near you by visiting the website. It's ohioentandallergy.com.